Assalamu alaikum. Thank you. Good morning, everyone. My name is Fahd Alaradi. I'm a fifth-year medical student. I'm here to present this talk on behalf of these lovely people. I want to thank the Department of Neurosurgery in our hospital, King Fahd Hospital of the university, for giving me the chance to be here. I'll be talking about attitudes and beliefs toward pediatric congenital neurosurgical condition, assessing awareness in the Eastern Province. Our object is to assess the level and the awareness about common neurological disease in the general population, exploring defects, misconceptions for better understanding for our community. Awareness, attitudes, and beliefs toward these patients are not really explored, and the number of studies that have been done in this field are few. An interesting study done in Uganda assessed the beliefs and attitudes toward these children with hydrocephalus and spina bifida, showed an interesting result that the great majority of the population there thought they are already dying or dead. Wrong beliefs and attitudes of the people around these children can play a great role in affecting their quality of life. So we constructed a survey consisting of 36 questions pertaining to hydrocephalus, brain tumors, and spina bifida. We distributed during an awareness campaign in our hospital held by the Department of Neurosurgery. Over 1,001 questionnaires were distributed. A total of 654 questionnaires were collected. 416 respondents from various health providers and 236 respondents from the public. So regarding the general population sample, 65% of them, the level of education they held university level or postgraduate level. Regarding their age, almost 52% of them are between the ages of 15 and 30. So we asked them in the questionnaire, have you heard or read about a disease called spina bifida? 32% answered yes, they've heard about it. 15% have ever seen a child, and 8% had known a child. When we asked the same question for hydrocephalus, 57% answered yes, they read about it or heard about it. When we asked the same question for brain tumors, almost 96.5 answered yes, they've heard about it. Same question for comparison. We asked the healthcare providers, and obviously they've heard or read about it or seen one. So we asked them, do you think it is contagious, those three conditions? I want to stress on the I don't know answer, because almost 46% of the general population sample didn't know if spina bifida is contagious or not. When we asked the same question for the healthcare providers, they got 90% for hydrocephalus, 90% for spina bifida, and 88% for brain tumors. So we asked them, what do you think is the cause of these diseases? The public were able to identify infection, vitamins, and deficiency, hereditary factors. Interestingly enough, superpowers such as evil eye were identified as a valid cause, 41% for brain tumors. Healthcare providers, when we asked them the same question, superpowers got the lower results. Treatment and prevention, I don't know answer, got the higher result, the higher percentage, except for brain tumors, for treatment and for prevention. When we ask, will they object having their children play with those kids having these conditions, 50% of them either said, yes, we will object, or do not know if they will object or not. Healthcare providers answered no for 80% for hydrocephalus, 81% for spina bifida, and 80% for brain tumors. Sorry. When we ask, will they object having their children marry a person suffering from the mentioned diseases, 80% of the general public sample answered either yes, they will object, or they don't know if will object or not. The interesting thing that the healthcare providers, the majority of them answered don't know if we will object or not. When we ask, do they think people with the mentioned diseases can be employed in normal jobs? The public answered yes, and the healthcare provider answered yes with these percentages. This gives us that there is a clear social stigma following these children. Ignorance about this medical condition question poses a real problem. There is a major gap of awareness between the healthcare providers and the general public. So what we should do, we should educate the general public. We should educate them with a simple, understandable message that for all levels of education, involving the social media to spread the word. Also, awareness campaigns may play a major role. Thank you.